Hello, everyone. I'm Ashley Cross, and the healthcare topic I'm going to be covering today is patients' adherence to doctor visits and their medical transportation. In the first slide, I'm going to go ahead and give some information about my interviewee and what his job title includes. My interviewee is a healthcare research manager, and his job duty includes helping patients maintain a healthy lifestyle while trying to keep their healthcare costs to a minimum and medication to a minimum if possible. And he does this in different ways. Some of these ways are encouraging patients to be healthy, developing exercise planned based on their needs and abilities. And this just means that he's not going to assign someone an exercise plan that they physically can't do or that is going to be unsafe for them. And by doing this, he helps patients lose weight if necessary and helps patients manage their chronic conditions. He also helps patients build lean muscle and strength through exercise. And many patients that seek these type of services do have chronic conditions. And by regularly exercising and managing their weight, they can help improve the symptoms of their chronic conditions. In this slide, I'm going to cover why I picked this topic and how is this topic relevant to my interviewee. So patients who seek these services, they're often dissatisfied with their current healthcare provider, and a lot of them feel like their conditions are really only being managed and not improved, or they're not being taught how to improve their conditions. And many patients have trouble affording healthcare, such as medications and regular doctor visits, which come along with having a chronic condition. Many chronic conditions are manageable only if the patient attends every regularly scheduled medical visit. And some patients seeking these services cannot always get to their appointments for various reasons. And some of these reasons are a lack of transportation. The patient could live in an area with little to no public transportation. Also, the elderly may have more trouble accessing transportation, and many patients cannot afford regular transportation. And some patients do not understand the importance of maintaining regular visits. So, this would go along with patient education. And these are going to be the main questions that were being addressed. How can we provide transportation to patients? And this includes medical transportation and private transportation. And are there any local services we can take advantage of? How can we encourage patients to attend their regularly scheduled medical visits to help them manage their chronic conditions if they have one? And how can we get patients to understand the importance of regularly scheduled medical visits to manage their chronic condition? This slide is going to be covering the iron triangle model. And the iron triangle model is a model that describes the relationship between quality, cost, and access to care. And according to the model, the relationship between these three components is situational. It is said if two move in a positive way, the other will move negatively. And this is all interchangeable. This is an example. If a patient has more accessible access to care and the cost of care is cheaper, the quality of the care will decrease according to the iron triangle model. This slide is going to go more into detail about the cost of the healthcare issue. The cost of addressing the issue is situational because there are many factors to consider and it is a multifaceted problem with more than one solution. So we're really asking, how can we provide transportation to patients? Are there local services we can take advantage of? And the coaching services are done virtually, so therefore the patient can be located anywhere. And this is going to make the factors varied. The local services are going to depend on the patient's location, their age, their insurance, and more. And many insurances offer rides to medical appointments for patients. So many government based insurances do offer free medical transport, and then there's also some private insurances that offer medical transport. But it's not going to be always covered, and some of them are limited to, say, so many rides per month. So even if a patient does have it covered by their insurance, it could depend on the length of the ride, how often they use it, for the monthly price. And also, there are local services that can provide rides to and from appointments, but a lot of these are only going to be available for those who are disabled, have a certain medical condition, or are elderly. And this also is continued going into the details of the cost. And what we're asking here is how can we encourage patients to attend their regularly scheduled medical visits and get them to manage their chronic conditions? Also, how can we get patients to understand the importance of regularly scheduled medical visits when they have a chronic condition to manage? And for this service, providing patient education is a service that is included, so it will not raise the cost. But there are also some factors to consider. Patients who seek these services are often dissatisfied with their current healthcare provider, or otherwise they would not feel the need to step out and seek additional help. And this can affect their willingness to attend their medical appointments. So, of course, if a patient is dissatisfied with their current provider, they're going to be attending their medical appointments less, which will provide them with less patient education. Now we're going into more detail about the access. And the access issues we are addressing is the access to transportation and the access to patient education, which are tied together. And depending on the patient's location, it can be easier or harder for them to get to their regularly scheduled medical appointments. And an example of this is, let's say a patient lives in a big city. Are going to have more access to public transportation versus a patient that lives out in a more rural area. Also, a patient who lives in a big city will have more access to programs that help with rides. And again, a lot of these are for the elderly, disabled, those with certain insurances, and those with certain medical conditions versus a patient covered in a rural area. And this is not to say that patients in the rural area are not going to be covered. It's just because in the city, there's going to be more of these services that are going to be closer to be able to get the patient if they need medical transportation or private transportation. And patient education is going to depend on a few factors. Does the patient's primary care doctor provide them with proper patient education? And also, does the patient have access to the internet or the know how to look up information regarding their chronic condition? We have covered the cost and the access, and the last component of the iron triangle model is quality. And the questions we are going to be addressing today is how is the quality of the transportation services provided? And how is the quality of public transportation in a patient's area? And these are going to be important because many patients with chronic conditions are going to need medical transport. And this is because they may need special equipment or accommodations to be ordered to safely get them to the doctor's appointments. And if a patient cannot afford medical transport, they may not be able to take public transport as well if they are not able to meet the needs of their chronic condition. And also, how is the quality of the patient education being provided? And every patient with a chronic condition has a right to patient education, and they should be informed of the most effective way for them to manage their chronic condition. And if a patient does not attend regularly scheduled visits because of lack of transportation, they're going to be missing out on a lot of patient education. And also, if a patient does not have access to transportation, they may not be able to visit a specialist or someone more knowledgeable than versus their primary care doctor to help them manage their condition. So you may be wondering, how are they all connected? And the costs of patient transportation can affect the quality and the patient's access to it. And there are roughly 3.6 million American citizens who miss their medical appointments and will delay seeking care because of lack of transportation. And again, some patients cannot use public transport due to medical conditions, and patient transportation costs can vary wildly and will depend on the location and the patient's insurance. And I'm not going to read every charge on this graph, but if you take a look over here, just for example, we have the ambulatory base rate weekday business hours. That's going to be 20 to 25. So say you have it on the holidays, that's going to be 30 to 45. And then the prices go up depending on if the patient is going to need a wheelchair base, if they are going to need a stretcher, and the price keeps going up the more the mileage is, and also there's going to be the wait time fees, which is going to be how long the private or medical transport is waiting per 30 minutes. And also, there's going to be additional fees depending on the weekday, the weekend, or if it's the holidays. And these are some additional factors to consider. So, as I just explained in the previous graph, the prices can vary greatly. So, if the patient must pay more, which is the cost for transportation, it can reduce their access to it. So, therefore, if a patient does not have access to transportation, they will miss their medical appointments. So, it is reasonable to conclude that if a patient has less access to medical appointments because of the cost, the quality of the patient education will be questionable. Also, if a patient cannot afford the cost of a medical transportation, they cannot adhere to their regularly scheduled doctor's appointments. And missing their regularly scheduled appointments is going to provide them with less patient education and may actually be dangerous for some with chronic conditions. An example of this is a diabetic patient needs to get their blood work done frequently. And if they can't get in to get that done, it's going to be more dangerous for them if it doesn't fall in the appropriate levels. So the insurance provider can really affect the cost, the quality, and the access to medical transportation. And this slide's going to be coming to the conclusion and kind of how everything ties together. So if a patient spends more on transportation, the component is the cost, and it's going to be negative because the patient is spending more, the further they will be able to travel and the more they will be able to attend their appointments. And this is going to increase their access, which is going to be a positive correlation. So we have the negative correlation, the cost, spending more, but it causes the positive correlation by increasing access. Also, when a patient can travel further, they are going to be able to seek out more specialized care, which will increase the quality of their care and patient education. Also, by paying more, a patient can attend all of their regularly scheduled appointments, which again will increase the quality of the patient education. So, just in summary, the more a patient spends, it's going to be negative, but it will provide two positive components, increasing their access because they're able to seek out more care, get better education, and the quality of the patient education will go up. And again, there are many factors that can affect how much a patient can pay, such as their insurance, age, medical status, location, and more. And this is just my reference slide. Thank you everyone for watching. And just a note here, my images were provided from Pixel. Thank you everyone for listening.